He's also the founder of Myntra and writer of the brilliant book, No Limit Art and Science of High Performance. And you're also the best 40 under 40 entrepreneur. Now, words will not justify your introduction, Mukesh. So we'll probably get started. Thank you so much for joining, and let's go ahead with your content.
Thanks, Nidhi, for the kind introduction. And I guess good morning to everyone in Bay Area or US, I guess, dialing from there. I'm dialing in from Bangalore. Happy to be on this panel. So I'll just briefly share a little bit of my involvement in COVID response, along with, I think, pretty much the entire VC and entrepreneurial ecosystem in India. Many of them are, of course, IIT and IIT Kanpur alums. So I'll talk about two projects. First is, app grants. So this, came together in the very early days of COVID. Literally when as the country was shutting down, many of us in the entrepreneurial ecosystem started, having these Zoom calls and brainstorming on what can we do. And one of the thoughts, came up with that, we have access to potentially a lot of funds. Can we raise a grant fund and then turbocharge innovation in the COVID space? So we ended up raising this 100 crore grant fund. It was contributed by a large number of people and organizations. So various foundations were involved. A lot of VC firms have directly contributed, or their partners have contributed. Most of the entrepreneurs in India have contributed. So we are able to raise this 100 crores in just 2 weeks flat. We put together an organization with the investment committee and a voluntary team of over 100 people. We launched a website in a few weeks, and during the course of last 6 months, we received over 2,000 proposals. We were able to make a grant decision within days. Grants could range anything from 10 lakh rupees to the highest grant we made was about 10 crores, and variety of solutions. In the early days, we funded various initiatives to scale up testing for COVID. A lot of work done on the increasing the supply of PPE kits. A bunch of stuff in India for oxygen supply as well, because it was emerging as a good first line of defense before people get into ventilator. There are some innovation in the ventilation space itself. A lot of our work was for building various telemedicine solution, and some of those solutions, not only initially helped with the telemedicine for COVID, but also morphed into providing support for things like mental health issues during COVID pandemic, other issues that, medical issues people were facing, which they were not able to get help from hospitals, etc. A lot of work done on the remote home management. So as the number of cases started to spike up, and there was 3-month period where there was acute shortage of hospital beds, but a lot of people, mild symptoms, etc., can easily be managed from home. So we created this home quarantine solution where everything was monitored remotely, and many tens of thousands of patients were treated that way. So it's looking back, feel pretty good about this initiative. This is an example of an entire ecosystem coming together, pooling in resources, both time, money, and channeling into a short-term organization where people who are literally working around the clock. We had various work streams for evaluating, managing. It's like almost like a VC fund that with a lifespan of only 6 months from fundraising to deployment to impact. But I think this fund has played its role. We were also able to get a lot of leverage from various foundations. So in many cases where we will make a grant for, let's say, a couple of crores, but we were able to get matching grants from either governments or foundations. So got good leverage on that. One of the large projects that came out of it is what we are calling it SWAST. So in the early days of, as we started making grants, it was pretty clear that as India gets into millions of or potential tens of millions of cases, access to some kind of medical care through telemedicine will be very important. So we funded this initiative SWAST, where it was led by various health tech companies in the country. Some of the logos that you see at the bottom, if you're familiar with those. But these are all the leading health tech companies in the country. So they all came together. They agreed to develop a lot of technology in an open source mode. After first few weeks, various large hospitals like Apollo, Manipal, Columbia Asia, Medanta also joined the initiative. And then over a period of time, larger health ecosystem. So what, so Swasth has also come a long way in last 6 months, probably, I would say 3 phases. First phase in the first 2 months was just putting all this, solution together. A lot of technology was donated by various member companies. We work closely with variety of government stakeholders, central government, state, many district officials deployed the solution in many states and districts, and manage huge number of COVID cases, both from telemedicine perspective as well as from a home quarantine perspective. As we were getting traction, we started to, the lot of folks who were involved in the Swasth initiative, we started thinking, a short-term impact is great, but is there something long-term also possible here, given that we have the attention of most of the health industry in the country? We were getting pretty good collaboration with government. So kind of middle part of this, we started thinking about transforming Swasth into a long-term organization. And at that point, we started collaborating very closely with the government of India. Incidentally, so happened that there has been a standard that's been in the works for last 2 years. In India, the government called it NDHM, National Digital Health Mission. So we started collaborating with them, and the thought process emerged that Swasth as an organization can play a anchoring and facilitator role in getting NDHM over the finish line. NDHM, those of you who might be familiar with UPI in India, it was a financial inclusion standard that was launched 4 years ago, and has since then, gone, has scaled up, massively. It's one of the largest digital payment ecosystem anywhere in the world. There is a similar thought process behind NDHM to make digital health records, interoperability among service providers, etc., feasible in the country. So, as Swasth, we started working closely with the National Health Authority and Niti Aayog, and now we have signed an MOU with them. The intention is to work closely with the government and evolve Swasth into a reference implementation app for NDHM. So it becomes like a first public solution for what's to showcase what's possible in the digital health ecosystem, and use that as a backdrop to recruit all variety of health providers in the country to plug into it. It's a long-term journey, but if it comes to fruition, we'll have pretty sophisticated digital health backbone in the country, which should service the need for large number of people, making the dream of universal health possible in the country. So we are very optimistic about what's possible. This effort is moving ahead full steam, and we feel good about this initiative because it not only was relevant and meaningful during COVID, but we are also able to transform to something really long term. Now it's a full, it's a full-time organization. We have recruited CEO. The 4 folks have joined as a full-time team. There's a governance board with a lot of prominent names from Indian industry and health industry. Very active collaboration with the government, and we are really hopeful that this ends up being one of the initiatives which will have a massive long-term impact as well. So that's in a nutshell, a couple of initiatives I was involved in. Happy to share our journey and learning with you, and I look forward to any questions and if you may have. Thank you.
Absolutely, Mukesh. Thank you so much. That was a wonderful introduction of ACT and Swasth as well. And we do have questions. And before I dive into the list of questions, I also want to point out that I know our attendees and panelists will have questions as well. So please be ready with your questions while we have Mukesh on the line. So Mukesh, first thing, you mentioned NDHM, the National Digital Health Mission. And so how does that impact Swasth or the future of healthcare in India? How do these coordinate with each other?
So NDHM is a set of standards. It starts with the unique patient health ID. Then there is a standard for patient health records. There is something called centralized doctor registry, which will have all sort of verified doctors. And then there are protocols about how do we exchange patient health information, how do various health providers can plug into each other. For example, if you get a prescription from your, let's say, local doctor, and then can their prescription be routed to one of the medicine delivery companies? If they are diagnostic tests recommended, can they be routed to a diagnostic service provider? And all of it done in a way where the health information that's generated, it's stored centrally and is available to a patient. So even though your health records are getting generated with various providers, but you have control on that. And tomorrow when you have a new health interaction, you can give permission. So there's a consent manager concept. You can give permission for a new provider to fetch your health records and use it for, let's say, either insurance purpose or you're getting admitted to hospital. So it'll make it very, very easy to pull out your entire health history on demand without anyone in the ecosystem really owning your entire health record. So it's a kind of federated architecture. Patient is fully in control, but every participant in the ecosystem can use it. So Swasth role in this twofold. One is we are helping implement many components of NDHM. Second, we are evangelizing and handholding many of the participant companies to adopt NDHM. So the vision here is over next 1 to 2 years, we start with the top few hundred players first, and eventually take it to grassroots level. So even if you are a individual primary care physician practicing, standalone, even that person should be plugged into NDHM, and that way it becomes a kind of fully orchestrated platform where people operating independently, but they have a lot of interoperability among them.
That is amazing. So the two organizations integrate together to work towards a common goal. That's how I see it. So Mukesh, there are long list of questions, but I do see a question in Q&A. Let me read that for you. What was the process of collaborating with government? Did you face challenges proving the potential benefits of Swasth?
Right. So, government is always a mixed bag. It's never anything straight line. And during, pandemic time, there was also a lot of panic and confusion among the government ranks. But simultaneously, I think there was a very serious intent. So, we would have talked to various, government officials. We managed to find some very strong sponsors and who put their entire weight behind what we are doing. So, barring, some hiccups and some, U-turns, net, I think it's been very collaborative, to the extent where now we're at a point where government is actually leaning very heavily on us for implementation of NDHM. This, from this organization not existing all the way to, being counted upon to do heavy lifting for NDHM. I think it's very progressive. We as Swasth got an opportunity to present the entire solution to Prime Minister. He gave us nearly 90 minutes in July. He talked about NDHM in his 15th August speech. So yeah, I'm, this is for me, first time, seriously working in government, and I'm honestly quite impressed with the speed, agility, and commitment that the government of India has shown towards, collaborating with many of us private players.
Awesome. I'm pretty sure they're equally impressed as well, Mukesh. Okay, I'll quickly move on to next question. Where do you see the biggest impact from digital healthcare delivery and centralized record management? That's a big one. You have a lot of integration going on, right? Go ahead, please.
Right. Yeah, I think, the biggest impact in the long term will be a democratization of, health services. Today, like most things in India, healthcare is also, there's an outstanding healthcare available to certain segments of, society. If you look at top 100, 150 million people, but you look at next billion, that things are, quite dire. So what I think digital health ecosystem will do in many ways, make low cost services available to much larger segment of players. It will create a backdrop for innovation. Once you digitize, building blocks of entire health ecosystem, people can create innovative services on top. Someone can create low cost solution, specialized solution, or bundled solution where you take different components of health ecosystem and create innovative services on top of that. If I just again use the parallel from UPI unleashed this massive innovation in fintech space, and a lot of companies come up that in the monolithic world of these big banks that could have never happened. So we are hoping that similar level of innovation will come up. This will also make it easy for things like OPD insurance, etc. come up. Today the state of primary care is very poor in the country. One big reason is all primary care spends are out of pocket. Insurance only covers tertiary care. So with the digitization of the patient health records, managing quality of OPD and controlling building risk models will become easier, which should pave the way for OPD insurance. And that should lead to a lot more people opting in to primary care, which should reduce the downstream cost of healthcare. It also because our digital in nature and with heavily supported by telemedicine, people from any part of the country will be able to access quality experts. Today for people in smaller towns and villages, if anything significant happens, they need to travel to a city for a 5-minute appointment to figure out what's going on. Through telemedicine, I think hopefully people will be able to get this done a lot cheaply and affordably without disrupting a lot of their day-to-day lifestyle.
Makes sense. So right now, I'm picking a question from chat, which is from one of our panelists, Bharat Sham, who is the founder of Restart Ventures. The question is, what is your projection on when India will finish vaccinating a large proportion of the population? And we need exact date. No, I'm kidding.
Yeah. Fortunately, India has a very strong history of vaccination. If you look at the last, few decades, there is so many, diseases that have been eradicated, through massive vaccination effort. So we have actually that, grassroots level infrastructure, between government player, private player, cooperative players, and so on, which have massive reach. So I think as long as doses are available, and I mean that's I guess anyone's guess, right? When the vaccines will be approved and large scale supply will be available. But distribution actually will not be a big challenge. I think people estimate that at least good chunk of the country can be vaccinated in just 6 to 9 month period. At least in all the big cities where the infection rates are more concentrated. But yeah, for that to happen, we first need to find vaccine. Again, we have massive manufacturing capability. I think, I don't know if you guys know or not, but India supplies as much as 25-30% of all vaccine doses in the world. So we have the manufacturing capability, we have the distribution capability, and some of the pharma companies in India also in the race to figure it out. So yeah, once we have vaccine, I think from there on, things should not be too difficult here. Hopefully it's not too expensive.
Exactly. I mean, having a solution is important. Let me move to next question. How has the medical community responded to digital healthcare platforms? Are there any drawbacks, misgiving?
Right. So, pandemic has accelerated the adoption of digital health in a very big way. I'm sure not only in India, but globally. I think WhatsApp has emerged as the biggest telemedicine platform where people just, message their doctor and getting their prescription just like that. But many telemedicine platforms have sprung up. They've seen immense growth. Many of the hospitals, established healthcare players have also launched their telemedicine platform. The regulation is also evolving. Today I would say it's not very, very conducive to telemedicine. The government, to their credit, have done a couple of rounds of clarification on telemedicine policy in last 6 months. Some more are in the works. So in some ways, I think, the pandemic is acting as a catalyst and inflection point for entire health industry to slowly but surely move in the digital direction. I think that machinery is kind of unleashed. I think will play itself out. Having said that, there are reservations, from various lobby groups and also from many doctors, who are skeptical about efficacy of being able to diagnose, etc. So it's a ecosystem shift kind of effort which will take multiple years, but definitely momentum has decidedly shifted in favor of adoption of digital health.
So when you say doctors and in general the healthcare community could be skeptical, is in what context does that relate to security, compliance, or in what sense?
Right, I think a variety of issues, right? First and foremost is, each, in India, especially in the a lot of doctors, they practice in a standalone basis, and
Mm-hmm.
they over a period of time, when their practice established, they will have few thousands, customers who are their regular customers. So
Mm-hmm.
first fear comes in a digital world, the losing customer just one click away. So
Yeah.
that's a very big fear of,
Excellent.
just doctors on. Second, there are, a lot of debate about what can be realistically diagnosed online, what cannot be, what definitely requires a physical visit. There are operational issues, I mean, we continue to be huge cash economy. The moment you try to, shift anything from cash, to digital payment infrastructure, there are, winners and losers in that. Then there are huge, lobby groups, who see any innovation as a threat to their current vested interest, right? So kind of all of this playing out.
There are both side of forces. Makes sense. Okay, moving on. Um, is there a model of healthcare delivery that you're using as inspiration? I know globally there are multiple, there might be many best practices. Is there anything that you think can be brought into India or even USA, or what is your thought on that?
Right. So I think many of us who are involved in this, we actually actively look at various healthcare system. I think the core idea, one is, most healthcare system also evolved, over last, depending upon the which geography you look at, last 20 years to last 50 years, right? So they also have a lot of their own baggage. It's unlike, let's say, a lot of tech-driven innovation where you can look at something that's come up in last, 10 years and
Mm-hmm.
look to model after that. I don't think there are many relevant, parallels. I mean, all of you guys know US have, its own whole set of, issues around healthcare system. I think the one of the idea that all of us believe is like how primary care is done with the National Health Service in UK. I think that model works very well. In
Yeah.
other geographies also where primary care is almost mandatory, and you can't get to a specialist, etc. Before managing things at a primary care level. So we are, as part of NDHM and SWAST, we are really trying to figure out how can we make primary care at the corner at the key founding stone for building this healthcare system. Other, I think digitization. I think the thought process here is quite futuristic. I really don't think there's any part of the world which have gotten managed to fully digitize all aspect of their healthcare system and make it accessible, linked to a single patient health ID. Again, as you guys know, the India has a huge experience first with Aadhaar, building their Aadhaar ID as an infrastructure element for over a billion people, and then UPI. So in many ways, we still need to cross a lot of hurdles, but if we manage to do it, it will be the digitization point of view, it may be one of its kind globally.
Awesome. Completely agree. So, Mukesh, you mentioned the ACT framework. Amazing. But can you throw a little bit more light on how does that, in context of Bay Area, or people who are outside of India, how do these two uh, concepts can come together?
Right. So, we actually got tremendous support from Bay Area. I mean, I don't know exact numbers, but my sense is at least 30% of our funds came from, people who are part of the, let's say, larger tech community in US, where the various funds, individuals, etc. Um, we are actually in the process of, we are so energized by the experience of ACT. We are actively thinking how can we apply the same model to maybe some other social impact agenda for the country, be it education or environment and so on. So very actively thinking of modeling something long term around ACT experience. So maybe I'll suggest folks on this call, if you have an interest in getting involved in a social impact agenda in India, you guys can reach out. Perhaps through Nidhi, you can reach out to me, and I can connect with other folks who are involved in ACT. We'll welcome any kind of support and happy to share. Thinking as it's evolving. There is definitely a pretty ambitious agenda, and a lot of well-meaning people have come together. So I expect the ACT, way of doing things to continue, hopefully beyond health as well.
Amazing. It's a lot of great work, Mukesh, and I wish you very best. And thank you so much for taking this effort forward. Do you have any? I don't have more questions. I mean, I have a million questions, but that can't be answered right now. Do you have any ending note or thought for our community, for us?
No, thank you, Nidhi. I think, it's a pleasure being on this panel. Great to see this initiative. And in general, I want to again echo, I think, last 6 months, I've been, personally quite humbled and inspired by seeing, people, who are really coming out of, and going out of their way to support pandemic response in a variety of ways. And in some ways, I think you started saying that obviously, it's a difficult time for the globe, but that aspect of community and humanity shining through has been super energizing. And I'm sure there are many such stories in among the IIT community in Bay Area and US as well. So I will look forward to staying in touch with you guys, and wish you all the best. Thank you.
Thank you so much. We are honored to have you here. Thank you so much, Mukesh.